Okay, testing 1, 2, 3. This is Deb Savage, and we are going to get started with Lecture 1. We're going to go over Chapters 1 and 2. And what Amy and I decided to do with these PowerPoints, as we've explained in class, is go through them in this manner so that we don't have to set through all of these in class. So we're going to go through the slides as they are presented to you. You should have copies of them. If you want to take notes, you can. And as always, you can always visit with us and ask questions. One thing I've learned is that I cannot start and stop over with this. So excuse me if I make some mistakes from time to time. If I could stop and start over, I'd fix them. But this is a learning in process for me. So we'll see how it goes here. Okay, so we're going to start out with the introduction part here. Slides 1 through 6. I think it'd be best if you just read on your own and go through those. Real Balance is a global wellness service. It's a company that was established by Michael Arlowski. He lives in Fort Collins, Colorado. And one of the reasons that we decided to have coaching in a leadership class is it's about communication and how one sees people. Oftentimes we see people as needing to be fixed, or do we see them as whole and complete with their own answers? Think about the managers you've worked under. How did they treat you? Which attitude do you prefer? Wellness coaching is not a treatment. Wellness coaching is about delivering help to people who want to make a lasting lifestyle change. This is an opportunity to certify as a wellness coach. We will cover in more detail in class. However, basically you have to complete 4 tasks. Complete this class for 32 hours of classroom training. Complete 5 buddy coaching sessions and the coach's notes, and 6 volunteer coaching sessions with notes. Complete the case study based on volunteer coaching sessions. Take the final exam through Real Balance. And we will discuss all of these in class, so you don't have to worry about keeping track of that. The case study guidelines are there. You can look at those, but again, we will go over those in class. You don't need to know anything about this slide. This was used for when they connect people internationally on time zones, but we're not going to be doing that. This is slide number 10. Consider what you hope to learn in this class. As we review material, think about how you can use this new way of communicating at work and with your friends and family. On page 5, or it's a V, of the preference in the manual is a list of characteristics of a good coach. Look this list over. Use these characteristics. Which of these characteristics are strengths of yours? Which are challenges? Some of the more important characteristics are as followed. Coaches are committed to living the healthiest lifestyle possible themselves. They have fairly low needs for control. They have to be very centered emotionally and calm in a crisis. They are patient but not indulgent or enabling with their clients. They tend to see patterns and be good systems thinkers, and we are going to discuss more about systems. They love to strategize and develop new ways to do things. They have a belief that mind, body, spirit, and environment contribute to health and well-being. They embrace challenges instead of fearing them. They are perpetually curious about life in general and human behavior in particular. They have an interest in health and health systems. And again, we are going to have a guest lecturer, Dr. Doug Christensen. He's going to speak a little bit about understanding systems thinking. On page we'll go page 7 of the preference lists the ICF Code of Ethics. You will need to refer back to these for your case study. Treating people with dignity, modeling standards of professionalism and maintaining confidentiality are some of the highlights of this list. And again, we'll go over these, so don't feel like this is the only time you're ever going to see this material. It's not. Okay, so let's start with Chapter 1. This is slide number 13, and I'm going to discuss 13, 14, and 15 as a whole theme. Wellness is a way of living, a philosophy of life. Wellness coaching is about helping someone create lasting lifestyle improvement on a behavioral level. We have talked in previous classes about being aware and conscious. This is where we bring this all together. There are many definitions of wellness. Although there are some differences, the majority of them center around being holistic, positive, and self-affirming. This is slide number 16 and 17 that I'll talk about now. These are some of the folks who have been influential in creating the paradigm shift referred to in slide 4. This chapter will look at what really defines our health, help to understand the wellness continuum, and maybe start you thinking about how you define your own wellness. We'll talk about Dee Eddington and Larry Chapman a little bit. This is slide number 18. We're going to talk about 18, 19, and 20 together, because again, to go over each one of these individually doesn't make sense to me when there's a theme identified or a pattern identified, and so this is what we decided to do just based on course evaluations from the past. So starting with slide 18 here, what determines your health? Are you surprised that according to the CDC, 53% of your health is determined by your lifestyle? Scientists have identified places in the world where there is extraordinary longevity. Large groups of people not only live very long lives, but are very healthy in their lives as well. The studies about these blue zones have been shown that only 20% of our longevity is determined by genetics. The other 80% is lifestyle and culture. The common denominators list shows the most important lifestyle factors. In page 6 of your manual, you'll find that you can go into more detail with this, and you can explore the Blue Zone website, which I would encourage you to do. It's pretty interesting. And on the bottom of this slide here on number 20 gives you the bluezone.com, and I would check that out. It's very interesting. Moving on to slide 21, this is the illness-wellness continuum. John Travis was a physician. He's one of the pioneers of the wellness field. He created this illness-wellness continuum. We are all on this continuum. Most of the people we work with are on the left side of the continuum and moving toward premature death. And I'm speaking about in the healthcare field, where we take care of people that are sick most of the time. Dr. Travis believed two basic concepts. Wellness is a process, never a static state, and illness and health are only the tip of the iceberg. To understand their causes, you must look below the surface. So I would encourage you to look at this continuum and even see where you're at on the continuum. This is slide number, where are we at? 22. Lifestyle medicine is the use of lifestyle interventions in the treatment and management of disease. Lifestyle intervention is an essential component in the treatment of chronic disease that can be as effective as medication. Think about how helpful it is when people quit smoking, lose weight, or manage stress. This slide lists some of the websites that have a great deal of information on lifestyle medicine. And we're also, the first night, I believe, of the class, we're going to have Dr. Amanda McKinney speak with you on lifestyle medicine, and she also teaches an online course in lifestyle medicine if any of you would be interested in taking that. Okay, let's move on to Chapter 2. This is slides 24 here. 23 and 24 actually is what we'll talk about together. This is basically like a family tree, and wellness coaching is based on sound psychological and theoretical foundations. Abraham Maslow, Carl Jung, and Alfred Adler all started the shift to a humanistic view of people as more than just a pathology to study. They had a much more optimistic view of human potential and believed that people could act on their own account to create fulfilling lives. And this is sort of the beginning of the positive psychology movement. And you've also, in 305, I believe it was, learned about the strengths that you have and standout roles that you have. And so it's good to understand the good things that you do versus, the pathology and the things that we don't do well. Let's see. Carl Rogers is responsible for a huge shift in how professionals relate to clients. His approach is based on the power of the relationship between the therapist and client instead of the impersonal and analytical approach. This, though, is the beginning of the helper as an ally. Psychiatrist Milton Erickson was the father of American hypnosis and believed individuals had the ability to achieve wellness if the reason for an illness could be thwarted. Many other psychiatrists and psychologists continued this shift to solution-focused therapies, and these works in turn influenced the developers of modern-day life coaching. All of this is to say that wellness coaching is evidence-based practice with its roots in behavioral science. Thomas Leonard founded Coach University, Coach U, in 1992. This is still one of the biggest coach training institutions. The initial focus of the coaching field was on helping business people grow their careers. Life coaching has evolved into helping people actualize more of their potential and live their dreams. Psychologist Martin Seligman developed learned helplessness theory and learned optimism. This work gives us research that validates coaching based on positive psychology, approaching clients based on their strengths rather than their pathology. And you can look over this slide here. This is gives you an example of the research that has been done, that has been the foundation to form our current wellness coaching today. This is also Authentic Happiness. It's a good book. If you'd like to read it, we did not require it, but it's also a good book to read, and it's written by Seligman. One of the ways to wellness coaching is that wellness is about personal growth. Taking the time to help the person to review their whole life is usually more than worth the time and effort involved, and it helps the client and coach to mutually determine both what really is going on and where best to start. Help your client to do some foundational work on who they are, not just what they want to do. The mindset shift is the foundation of coaching, shifting from what's wrong and how we can fix it to what's possible. Think about our role as nurses or as counselors. After all, we are the experts who can fix all the patient's problems, right? In order to be an effective coach, we have to shift from being the expert to being an ally. How attached are you to your expert role? As a nurse, I always feel very confident telling patients what to do. I suspect if you're a counselor taking this course, you have some ideas on how to help people, and are able to give them some guidance, but really coaching is all about letting the client figure out their own answers, and that is very, very difficult, particularly for nurses, to let go of being the expert. We'd rather tell people what to do. Our medical treatment model is based on prescribe and treat, educate and implore, advocate and inspire. Prescribe and treat, this is based on the doctor being the authority and assumes most of the responsibility for the treatment. How well does this work? Well, think about the patients you see who return to the doctor or to the hospital with a non-compliance. Educate and implore is where many of us fall as nurses. We educate our patients. We have many computer programs designed to spew out pages and pages of information to give them. We then beg them to follow the instructions. We assume if the client has the information, they will follow the treatment. However, a client has no accountability. Neither of these are really very effective. Coaching, then, is about advocating and inspiring. We work with the client as a guide, standing by their side and assisting them to explore, set goals, and be accountable to themselves. This mindset says you are not the expert and you are not responsible. We see our clients as whole and not in need of being fixed or fixing. Fix sounds kind of like taking care of a dog or an animal, like you need to be fixed. That's not exactly what I mean there. A professional coach has the skills and resources to help the client to assess their wellness, determine their readiness to change, co-create a wellness plan, implement the plan with coaching support and accountability, and then support the maintenance of the behavioral change achieved so it will last. The nature of the coaching relationship is about promoting the independence, self-sufficiency, and self-efficacy of the client. The wellness coach supports the treatment process. They can become an advocate for the client by helping them take ownership of their health and helping them comply with the treatment regimen they have chosen. Our challenge, then, is to stay in the mindset of an ally. Think about what will be challenging for you to make this shift and remember it. As healthcare providers, as mothers, fathers, or preceptors, we have often been asked to be the expert. This is a comfort zone for many of us. Making this mindset shift will challenge you to step outside of the comfort zone. Now let's talk a little bit about motivation. What have been your challenges when it comes to clients being motivated to be well and to change? What have been your challenges when it comes to your own motivation? One of our primary values to our clients is that we are equipped to help them find the motivation within themselves to be well. According to Abraham Maslow, we are all motivated to actualize our potential and to grow. So there is a natural drive to achieve personal growth. However, there are many internal and external things that get in the way. A client's illness or the illness of a loved one may have caused them to go back to a fundamental physiological need or a need for safety on Maslow's hierarchy. It is important to know if a client is coming from a fear-based motivation or development-based, which is also called a love-based motivation. A fear-based motivation or external sourced, such as an avoidance of an illness and death, or I should do this, generally don't last long. Old school health education programs tried the fear-based approach. Frightening people often helps them get started in changing their lives, but the behavioral change is not sustained over time. We all probably can relate to someone pointing their finger at us, telling us you should do this. In fact, I've probably been one of those nurses that have thought to myself, why can't this patient get this? I don't understand it. If they would just do this certain behavior, they would get better. Then we have love-based motivation. Development or love-based motivation is based on personal growth. We've talked a lot about personal growth in your nursing courses, 305, 306, 307, and we continue to build on that in this course. Helping clients find that motivation to change so they can be around for their grandchildren and their children, or so they can participate in a certain activity with a loved one, can help people stay focused. Motivation is not intellectually convincing someone of the benefits of a particular behavior. The author J. Kimisek wrote a book called The Intrinsic Exercises. He shares research that found that people who exercise regularly have 4 primary sources of intrinsic motivation. They exercise for the fun, enjoyment, and stimulation. They have a feeling of accomplishment. They also experience a pleasure of learning. And they also enjoy the concrete benefits of exercise. They're sleeping better, they feel more calm, they have more energy. And I know for myself, when I exercise, I do feel better. It's the discipline of doing it on a regular basis that I struggle with. And I always have the same old excuse, I just don't have time. Ask your client what is their experience in doing a new behavior. Help them discover the intrinsic joys in movement, taste, learning, and feelings of accomplishment. Motivation is the most important foundational work on self that can be done. When that inner motivation or buy-in is reached, all coaching flows much easier. Daniel Pink wrote a book called Drive, and it's a good book. If you have an opportunity, you're looking for some extra reading, I would suggest this. You can also pull up on YouTube videos that Daniel Pink has done, and he talks about this. But he wrote a book called Drive, and his research found that increased pay actually decreased performance. Most companies base their motivation on increased pay or benefits or bonuses, thinking that they are increasing motivation. The reality is that people perform better when they are doing something they truly want to do, something that helps them find the intrinsic reward. We are going to talk more about are you running away from a certain thing or a behavior, or are you running toward a healthy lifestyle? We're going to discuss those in class more. So what is your motivation? What intrinsic reward are you looking for? James Prochaska is a psychologist who developed the stages of change theory. He says that people don't do a good job of weighing pros and cons of changing. They think the change will be more difficult or expensive or time-consuming than it really is, and they don't see the extensive benefits that the change will bring. And I can tell you, I would be one of those people that I can find all kinds of reasons, the cons, of why I probably should not make this change. However, I've also seen that when I do make a change and I'm successful with it, it really wasn't that bad. Resolving this ambivalence is not neat or logical. Exploring on the feeling level is just as important as exploring the logical side. One technique to help your client work through the ambivalence impasse is called motivational interviewing. Some of you may have heard of this technique, and it draws upon the same positive psychological roots as coaching and is defined as a directive, client-centered counseling style for eliciting behavior change by helping clients to explore and resolve ambivalence. This is a great tool for coaches to use at times, although it is more directive than coaching. Motivational intervention or interviewing helps clients look clearly at the contradiction that exists between what they want and the way things currently are in their lives. Remember that you are not trying to persuade your client. It is the client's job, not yours, to resolve their ambivalence. Helping the client discover their intrinsic motivation is one of the biggest gifts we can give our clients. Page 29 and 30 in your manual has a wonderful summary of some points to help you coach your client to discover and use motivation for lasting lifestyle change. Some points that will help you coach your client to discover and use motivation for lasting lifestyle are: pulling works better than pushing. Envision a healthy and well life. Help your client create a vision. Clients get good at dodging fear-based motivation. Denial and minimization are often used. Help your client shift the loving motivation to love of self. Help your client work on self-esteem, self-worth, self-compassion, and self-love. Don't be part of the problem. Be aware of your own prejudices and ideas about how the client should go about being well.